Hi, everyone. Welcome. Good morning and good afternoon to everyone tuning in. This is a special broadcast of Advocacy in Action for all of you out there listening. I know we're streaming live on Looms for Lupus, Support Fibro, and Men with Fibromyalgia Facebook page, along with our YouTube and Twitter channels. So welcome everyone joining in the broadcast. We love hearing from you, and we also want to know where you're tuning in from. So please leave a comment and let us know where you're at. And also throughout this whole broadcast, if you have questions or want more information, please leave comments. Please share this video. We are trying to break down some of the barriers for understanding advocacy and legislation. So that's why we decided to share this, because I'm new to it. I know Estella and Juana are very heavily involved with different advocacy coalitions. So I was excited to participate and join with them, but I'm in the learning process too. So anyone out there that's just interested, or if you feel a little bit overwhelmed, don't worry, because I'm right there. This can be very complex. So let's get started with some introductions, and then we'll go through some hellos really quick as well. Let me start with Estella. Can you introduce yourself?
Yes, good morning, everyone. I am Estela Mata. I'm one of the Mata sisters and co-founders of Looms for Lupus, a nonprofit organization that was created by my sisters and I to support those living with lupus once my sister was diagnosed in 2009. We also support those living with overlapping conditions such as fibromyalgia and mental health and their loved ones and caregivers. So we're just excited to not only support those that are chronically ill, but also everyone else in the community, because we know that if someone lives with a condition, it does affect everyone. My sister is a social worker, so her work impacts other community members. So this is why this conversation is going to be important. So I'm just excited to be here. Thank you for inviting us again with this special topic, Melissa.
And I'm Melissa Toller, the Executive Director of the Support Fibromyalgia Network. We focus on fibromyalgia patient education, medical education research, and of course, advocacy. So our goal is to really get everyone involved on all levels of advocacy. So that is why we have this Advocacy in Action presentation. Let's give just a quick shout out. Hi, Stacy from Missouri. We have other people turning in from all over the country. Don't hesitate to leave a comment and let us know. Say hello to us, and then also continue to ask questions as we begin our presentation. So I just want to switch to our slide deck here and go over. So this is, we're going to be presenting content from the Californians for Improved Patient Access. And what that is a coalition of patients, providers, advocates, and lawmakers who are working to improve California's access to needed healthcare through reforming the insurer practice of step therapy, or fail first. That was a full mouthful, Estella. So that's why we got to break it down. And so this is the Californians for Improved Patient Access Coalition, but this is actually happening all over the country. So, and we have a lot of organizations working together on this who actually are not just California based as well. So if you have any information and you would like any information, we'd be happy to get it to you. So Estella, I know you wanted to talk a little bit about just getting involved with advocacy and all this work. Like, what would you suggest for people starting out before we get into the presentation?
You're mute. Sorry. Yes. So I think the first thing that everyone has to remember is that regardless if you're healthy, regardless if you're sick, these important matters or these important topics are very, very needed in our community, right? So we may not be sick right now. We may not be in need of any health care, but a lot of the policies and a lot of the rules or regulations, if you want to call them, do impact us in some way or another. So for me, I consider myself pretty healthy, even though I do live with fibromyalgia. I think I have a very healthy lifestyle. However, there are so many things that, as consumers, because that's what we are, consumers, we're patients, we need to be informed of, one, the policies that are going into action, because these policies become rules. These are the rules that will guide and will help you either get the treatments that you need, or the healthcare access that you need, or it will not give you that. So it's very important for us to, one, learn about all of these policies and learn about how we can get connected and what can we do as just community members. We don't have to be sick, like I said. So what can we do? I think the first thing is to learn about how we could get involved, learn about what these policies are, who makes them, who creates them, who needs to pass them, and who are they going to impact, right? So once you kind of figure out what all of this is, then you start taking action, right? You start looking at, how is this going to impact me? Has it impacted me? Is it going to affect me adversely, negatively, or positively? So you kind of have to kind of figure out what all these things are. And how do you start learning about this? Is start engaging with your community members, start engaging with your assembly members, with your local state senators, with your congressmen, with you can connect with everyone that our congressional leaders have local offices. Our assembly people have local offices. Our senators have local offices. So we can connect directly with their office members, and they will guide us depending on what the issue that we're asking about or what concern we have. They will send us either to a local support, right, to local members that are going to be dealing with local constituents issues, which a constituent is basically you live under that specific area where that congressman or the assembly member, kind of guides, if you want to call it that way. So I think just knowing that you can connect, knowing that you just get informed and that you do have a voice because you do matter, and you do have the opportunity to make a difference if you do know that something is going to pass that you can voice your concern about or make a difference. So to me, I think that's what got us involved, knowing that my sister was sick, knowing that my father was sick, back in the day, knowing that you have rights as a patient and knowing that you want the best for your family, I think is probably the biggest driver for us, but it should be for everyone. Healthcare, most of us will need it at one point or another.
Well, and the big thing I want to just point out is it is definitely addressing like worldwide and just how we can work together to access and have patient access and what patient access looks like everywhere. So, I mean, hello to Lisi. Is it Jeanette from Puerto Rico? So this is a perfect example of how I want to learn like what access to healthcare issues does she work with and her family needs. And it's important we have these discussions as we move forward because it includes all of us. Like all of us matter. Your voices all matter to us. So please definitely join these discussions, share with your friends if there's topics or things that are coming up in your area that you want to address. And we'd be happy to even bring you on and have you share the discussions and points, like whatever you are at. I mean, it's important we break these down because it sometimes feels intimidating for all of us. And I definitely can agree that I was intimidated. I'm intimidated right now with what we have to go over. It's making me nervous, but that's okay because we're in this together. We'll work through this together and we'll learn from each other. And that's why it's so important. So let's move forward with some of the step therapy policies and how they hurt patients living with chronic conditions. So what we're doing is a campaign, and we're going to talk about this because a patient's treatment plan is unique and takes time and effort to work out. So the AB 347, so an assembly bill, helps ensure treatments are based on the counsel of a doctor, not an insurance company's one-size-fits-all approach. AB 347 will add protections and transparency to current utilization management protocols to ensure patients have access to the treatments they need without delays that can worsen their medical condition. So Estella, you want to break that down for us a little bit more?
So what is this AB 347, right? So it's assembly bill. And what are these bills? These bills are the ones that become rules or become policies, right? So it goes through several processes. So this one specifically is for step therapy. So what is step therapy? So if you really look at under my patient's rights, I'll give you, and I'll read the description to you because I don't want to get it wrong. So step therapy is really a fail first policy that requires certain drugs to be tried first, rather than the drug originally prescribed by your doctor. And this can result in a patient being put at risk for not receiving the most effective medicine when it is needed. So what does that mean? So in my terms is basically I go to the doctor. The doctor tells me, you know what, we have this treatment that will help you. It's specifically for your condition. So let me go ahead and prescribe this to you. So they go ahead and they prescribe it to me. And I'm so happy because now I'm leaving the doctor's office and I have the treatment that I need that my doctor recommended, and I'm happy and I am going home, right? So then I get to the pharmacy and they tell me, you know what, it is not covered by your insurance. So I go back to my doctor and I'm like, you know, it wasn't covered. And then what does this mean to me? The doctor then says, you know what, your insurance doesn't cover this, so now we have to wait. And they want me to try this other medication for you before I give you that one. So let's try what your insurance plan is offering. They want me to try this other treatment, which can also help you. It may help you, but they want this to be tried first. So it might be less expensive and, you know, they want you to try it first. So if it works, great. If it doesn't work, then we'll go to this other treatment before we go to the one that I originally wanted to give you. So just right there, that's a problem. Why do I have to, as a patient, that already my doctor has discussed with me my treatment plan, and he wants to give me this treatment that he knows it's going to be the best thing for me, and all of a sudden, he cannot treat me and I cannot get the treatment that I need at that time because my insurance wants me to try other things before that may be a little bit less expensive for them, that may or may not help me. Right? So that is really what step therapy is. And why is this important for us, right? It is important because we need to know if there is a treatment that is going to help me. Why do I have to go get another treatment, waste time, get worse? What if that treatment that they're giving me or replacing what originally my doctor recommended, what he thought was best for me, gives me an adverse reaction? What if I can't, it doesn't even make me better and it makes me worse? And now it damages something else. So you have to just kind of look at it that way and put yourself in the situation and think, do you deserve to not be given a treatment because they want you to try something that may be cheaper? Maybe something that they want you to try first and fail at it before they give you something that you may need to get you to feel better. And meanwhile, if there's one that failed, then you have to try a second one, then a third one. And meanwhile, not only does your hope, get hurt, you lose hope in the system, your body starts reacting to your mental health because now you're feeling so low, so you're hopeless, and now you're worse. So these are things that we need to think about. So this AB 347 will ensure that there is more open access to the treatments that us consumers, that patients need. And that's really how I summarize it, Melissa. There may be times where, you need to go through so many hurdles to get the treatment that you need, but I don't think that this should be up to a payer. I think it should be up to the treatment that your provider and you decide on. I think the worst thing that a patient can hear is, you can't get this treatment that's here for you because it's too costly. Does my life not matter? And I think that's really how I want to word it. And I know people might say, well, why are you saying the worst case scenario? Why are you saying all of this? Because people are dying. People are getting adverse reactions. People have to wait for their treatments. because there's a policy out there that does not allow you sometimes to get the treatments that you need.
Well, and it's good that we are starting to have this conversation, I think, more and more within fibromyalgia. To be honest, I have no idea whether this happened to me in the past. I mean, I had over 20 years of different medications, and I didn't know what step therapy was. I don't even know what was going on. So I can't even say at this point if that's what was happening with the choices I needed to make, or why maybe my prescriptions were changed, or I wasn't allowed access to certain things. And I think for the fibromyalgia community, I'm not sure we are talking about this enough to even know what's been closed off to us and what's available, especially with different infusions and when it helps to like pain, and other compounded medications as well. So that's where it gets really tricky and in depth. So this is great that we're having this conversation, and I appreciate Estella coming on to like educate all of us. It's so important, and Estella and Juan have been super involved with all of this. So I applaud them for their work and their advocacy work, and they've just stayed true to learning from so many amazing people. So we definitely appreciate it. They got me involved with this Californians for improved patient access. And I did share with everyone a link so this coalition has provided us with different resources that we can share with you. So this is all of their work that we're presenting right now. And I did share a video with you about step therapy, and we have some other videos that we can share with you. So you can watch the video and learn more about step therapy. And were there any other resources? I can keep posting comments, but Estella, you had other resources too from the coalition.
For like the under the My Patients' Rights, just for people to get educated. I think it's so important to know what all these terms are, because not everyone has the knowledge, right? Like you were talking about right now, Melissa. Did you ever go through step therapy? You don't know, because you really just depend on, the doctor to tell you this is what you're getting, and your insurance to say yes and approve it, right? And then you just take your medication. And if you don't feel good, you go back and then you try something else, right? So a lot of people don't know if they've gone through this. That's why I think it's so important for us to highlight what all of this means. And once we go through this session and once we finish talking about this, if you have had to try multiple drugs that your doctor has requested, and you have had to fail them first to get to the next step, this is a story that you should share if you want to, if you choose to share, because your story can make such a huge impact, and it will allow the legislators that are looking at these bills to understand what all these policies mean to you as a consumer. So these legislators are people just like you and I. And it is so important to understand, again, that these policies that are in place are the access that you are going to be getting, or the lack thereof. So if you have gone through what we were just talking about, the fail first policies, if you have gone through these hurdles, then please consider sharing your story. I'm not going to be a fruly. I'm not your friend that's going to bully you to say you must share your story, because no, it is your choice. It is your story. But what I want to do is let you know that your story does matter. We can't do this alone. If someone is going through something like this and voicing their concerns, it may make a difference in having a policy, moved and put into action. So can you imagine if your story makes a difference and saves people's lives? I think that's pretty incredible. So, those are, I just want to, again, highlight that, because this step therapy causes so many other issues besides, high cost to you. You're going to get more disease activity if you're sick already, and if you need those treatments, and you're going to get delayed in getting the treatments that you need. So to get more information about like what is step therapy, what are your rights as a patient, go to mypatientsrights.org. That is an amazing website where you can learn as a consumer, as a patient, as a loved one, as a caregiver, what these terms are that we're talking about. And you can also share your story or call them and say, hey, I think I may have gone through that. Let me tell you what I went through. And then if there is a story there to tell, that will help you. You don't have to do it alone. This is the most important thing. You are not alone in this, and you don't have to do this alone.
Well, and I'm about to post a survey. So this is through the coalition group. They've created a Survey Monkey, so you can share your story. So I'm about to share it in the discussion comments, and we'll leave it in the description of this video as well, because they are looking for people's experiences. And it looks like Sam out there, you're posting that your pain clinic, this is how my pain clinic is currently working. So they try to do the approved stuff first, rarely help. And then, so this is what you're describing if you're willing to share your story. I didn't know there was a Fruly, but I'm going to share this Survey Monkey so everyone can share their story, because it's definitely important for all of you to get involved, just like Estella said. And then we want to, I know this is the document from the assembly member. So we want to thank Assembly Member Arambula for introducing AB 347 to ensure that patients have access to the treatments that their provider actually prescribes. So this is all the documents from this Californians for Improved Patient Access. So if you want any more of this information, we'd be happy to give you the PDFs we've been shared with. So I think I did upload this one for utilization management reform, and you can see all of the coalition organizations involved on the side here. So I'm going to share that link. I was able to upload it to our website. If I can find the link, I'll get it shared. But I think it's cool that to see even your logo there, Estella, with Looms for Lupus, among these other organizations. So if people out there have other organizations that want to get involved, what would be your best advice? Oh, I just unmuted you. You're still on a mute.
Can you hear me now?
Yes.
Okay, perfect. The way we got involved is really, the way we did it is we went to our local. So if you're locally in California, you go to any local coalition. So we went to the California Chronic Care Coalition with Executive Director Liz Helms. So we went directly through her. We learned about what mypatientsrights.org was. We knew about that other coalition that she worked with, which was the California Chronic Care Coalition. And then so many coalitions work together. So coalition is basically, just I don't know if you can bring up on the site, but there are many sites, there are many coalitions, and what basically it is people getting together, or organizations getting together, patients getting together, and amplifying your voice, right? It's really, that's what it is. So we got connected with her, and then she invited us to this coalition. And basically what you do is you get to learn about what these policies are. If someone knows that there's some, negative impact in their communities, then they will go look and to see, how can we fix this? How can we make this better? And then that's when those bills or the bill ideas are created. Then they're written, right? They're written, and then they come and they ask you, well, hey, would you support this? And then as an organization, you can go ahead and support the bill if that's something that you want to do. So in this case, with AB 347, it really falls under utilization management reform. And this bill, we read through it, and we, obviously not a lot of people know what utilization management is, but the step therapy, that's where it falls under. And we read it, and we're like, we want to support this. So we attended, the introduction of this bill. We attended the supporting people that were supporting it and talking about it, giving examples. And then now we're in the phase where we want to gather patients' voices and see who is impacted so they can amplify the patient's voice and say, hey, this is why this needs to be fixed or this needs to be done. So there's not one specific coalition that you need to go to. We started with California Chronic Care Coalition, but also if you start working with any organization, almost every organization has someone that is, linked to or that may have information in regards to policies. But if you go to mypatientsrights.org, I think that's your best connection as a patient consumer, so you don't have to go everywhere. But I know for the sponsors for this bill, it was the Arthritis Foundation of America. I think if you go back to the other page, there are a couple of sponsors. And so Arthritis Foundation of America, the California Rheumatology Alliance, and the Crohn's and Colitis Foundation. So these three are the sponsors. And these sponsors are the ones that basically help write. And then, Dr. Joaquin Arambola from the 31st District is the one that created this bill, right? And is presenting this bill or backing up this bill. So then this gets presented to all these organizations and patients. Us as organizations, we read through it. And we are the ones that are supporting this, which is, if you go back to where we were, those are all the organizations that are supporting it because we believe this is something that is going to be impactful to our communities and our consumers. So yes, you see our logo there, and you see Melissa's organization logo there, Support Fibro. There's different organizations, you have the Crohn's Colitis, you have other different organizations that are on here, the MS community as well. So this impacts a lot of people. So it's so important for you to not only learn about it, but also learn how you can support it. And what do we do and why do we want to be on this? Well, because we want to bring it to you, the consumer. We're a small patient-led organizations. It is just like me and my sister running the show here, right? So we want to empower you because what we've learned throughout 10 years. We've gone through this and we want to help you and empower you because that's what we should do as a community. We can't say we're not, we're in this together and not bring you along. We can't claim to say that we are a patient-led organization and not lead the patients and the consumers. We are grassroots. We are here with you. I go and I meet with you in our support group and I empower you and I encourage you to be the best advocate that you can be for yourself. My sister is alive today because she advocated for herself. So it is my duty to help others do the same. So as a consumer, and I am proud to display my logo there because we are here for you. And even if you are at home and thinking, you know what, my voice doesn't matter, it does. Your voice matters. Even if you're in bed and you can't really move or go meet with your legislators or anything like that, then you can do it from your computer. You can pick up a phone and call. You can share your voice. You can say, you know what, this happened to me. And we'll guide you and we'll help you through all of this. So that's why it's so important. And that's why I'm so passionate about it, Melissa. And that's why I love working with you because you get what we want to do. We want to educate and empower others just like us to do, to share, to be able to make a difference in our community. So yeah, that's how we got involved. And then I brought along Melissa and I said, Melissa, you need to get involved. We are louder together. So let's amplify the patient's voice and let's do this. Let's educate our community. There's not a lot of people that know all these terms, patient access. Yeah, we might get it. Okay, it's access to us, right? As patients, we are the consumers. So therefore, just like when you go to Target, and this is what I think, if you go to Target and you buy something and it's not what you wanted, right? And it comes flawed and you're like all excited about this product that you just bought and that it's damaged or it causes you harm. What do? Right? You go back and you return it and you're like, hey, wait a minute. Like, this is not what I bought. This is not what I deserve. Can I get my money back? That's exactly what you are as a consumer, as a patient. and I don't want to keep rambling because, I guess I just get really passionate about this, but get connected. If you don't know how to get connected to the California Chronic Care Coalition, and I'm just calling that one out because we are connected with them. But there are so many coalitions that work together, all for the same cause. So it doesn't matter which one you get connected with, as long as you get educated, as you learn about it, and then you learn how this is going to affect you and what you can do. I think that's what's important.
Well, and I'm still going to put pressure on the system because I think what we're doing, reaching out to the patients, it's important for all of you out there to know, like, even as an individual, if you want to get involved, please reach out to us and we will get you involved. I think that's why we're doing this. That's why we're hosting these videos, to give you the information, because I think sometimes there's a breakdown in communication. This stuff is going on, but it's not reaching everyone. So how do we reach all of you and inspire you to share and get more involved and know that you're welcome too? I mean, this is for everyone. This is for everyone out there. And especially, just to, even if you're interested in learning about step therapy and maybe you're unsure whether you have gone through it, or for those of you that are going through it. So we want to hear from you. Your voice does matter through all of this. And that's why we are here, encouraging you to share for all of us. And I know a special shout out to Sam right here. She was asking, do you have any info for Canadians? And so this is, again, what we're moving towards. And I know we've launched this fibromyalgia working group internationally because we need to get this information out there. Like, we're not well connected right now with groups in Canada, but we are with advocates. So let us work together, figure this out, and make those connections, because what's happening in the States is there's something similar happening around the world. And how can we support each other in our community, whether you have lupus, fibromyalgia, or other autoimmune conditions? And we really have to come together as patients to make the changes that we need. So I would definitely love to talk to anyone internationally. And I think we have a call later today too, with an organization from Ghana. So I'm going to learn a lot about their healthcare experiences. But definitely share your story. I'm going to post the survey again as we go through the comments. Thank you, Karen, for tuning in. Kathy wants to be involved as well, so we appreciate that. And hello from everyone around the country. Hi. Oh, she's
Iowa.
from Iowa. So
this is so amazing, Melissa, and a lot of people always ask us, like, why do you do this, right? Why don't you just stick to like lupus and fibromyalgia? And I'm like, wait, you want me to stay contained in one thing, in one disease? No, this is about everyone. This is about working with other people, because this is about our communities. So it is so important for us to remember that. So whether you're in Canada, and we may not have the answer right now, because hey, Melissa and I don't have all the answers, and we are not experts in health policy. We don't have a policy degree. I work in IT, and Melissa's a functional health coach, certified, certified functional.
I'm a board certified functional medicine health coach, but
Yes.
I've gone from being bedbound to now transitioning over to doing this type of work. And we are training. So we are learning with our new patients rising. We're delegates. So anytime we're going to get more information, and we'll be on here sharing with our communities, because we can't keep this information. It's not about keeping this information to ourselves and excluding it from everyone. We want you to be involved. The more people we have involved, the more pressure we can make on our government to make these changes, because it's about the patients. We can't put profits over patients at all. We have to get our healthcare system straightened out to be healthcare, not sick care. And in order to do those policy changes, we need a lot of voices rallying behind it.
Yes. And you always think of right now, the first thing that always comes up when you're in healthcare, any healthcare, conference, or if you hear doctors talking about this, is we are patient-centered. And then that or patient-centric, those two words there, it just gives me chills, because really, show me, don't tell me. right? Make it about the patient. So, it's again, it's so important, but, and it's funny that you say that, we are learning, and it's not about us going through this 14-week course where the patient's rising for advocacy for us. We're doing it because we want to learn more, because you can never stop learning, and bring all this back to you. Our first class was about Congress 101. How do these bills go into practice? Like, what happens? When do they get written? And what process do they go through, right? So they have to go through 6 steps, right? They get written. Then after they get written, then they're reviewed, and then they're modified. Then they go to the House, and they go, there's like so many steps. But guess what? There is a step where the patient, the consumer, has the opportunity to raise awareness and to also share their voice. So share your story. And if you have experienced a step therapy, just please let us know, and this is what step therapy is. And these are highlighted in this slide, right? Step therapy occurs when your insurer requires you to try alternative medicines instead of the treatment prescribed by your doctor. You should not be forced to try medications your doctor did not recommend. And I can't emphasize that enough. You know what you need, and your doctor knows what you need. So it's very important that you empower yourself, that you advocate for yourself. And I know a lot of people don't like the word advocacy or advocate. Okay, speak for yourself. Be your voice. You're the expert in your body. You know what you need. So share your story if you want to share your story. If you don't want to share your story, just share this information to someone else that may be willing. I said fruity earlier, Melissa, and I know it's a new term, and I need to patent that, or I need to make sure that I get credit for that, because it is a friend, or those people that disguise themselves as friends that are bullies. No one should ever tell you that you must share your story, or that you have to share it now. It is up to you. It is your own right as a person to know, you know what? I want to share this story, and it is my time to share my story now. But if you don't want to share your story and you have gone through this, talk about this with someone else, because they might be willing to share their story, and they might not know that this happened to them. So that's why we want to continue to share this information with everyone.
Well, and please, if you're looking to learn more, the California for Improved Patients Access has started their own accounts in social media. So they have a Facebook page and a Twitter page. So the Twitter handle is CA Patient Access. And you can search for them, and we have it in the description. So they're going to be sharing a lot more information that you can always share with your community, and then also and just learn more from them. And we'll always have those resources. So if anyone has any further questions or wants more information about step therapy, we'd be happy to share those resources with you.
Yes, definitely. So does anybody have any questions? Have you guys had any experience with any of this? Have you guys ever had a discussion like this? I'm just curious to know, because I know that I had not. I had to kind of figure this out on my own. But I have been, in the healthcare industry for a long time. So, I'm exposed to more of these terms than anyone in my family. That's why I like to share, because, not everyone, again, knows about all these policies, knows about how they impact us. So, or even these terms. So I'm just curious to know if anyone had ever heard about what step therapy was. And this is just for me to know. I'm curious, because every time I tell people, have you been through this? They don't know what step therapy is, and it just saddens me to think that, you know, it's the lack of knowledge that will prevent us from using our voice. So many times, people don't speak the language. People don't understand terms. People rely on their doctors, rely on their healthcare benefits to help them live, a healthy life, and to be able to get the care that they need. But it's just sad to know that so many people lack the knowledge. It's healthcare. they're not healthcare literate.
Well, it is confusing. So like even understanding step therapy and understanding, but what can you even do about it? So breaking down that process in tangible information to know that it's going on. So Kathy mentions like, yes, I've been and still are in that situation. So she recognized it, but like it's still very like top level. So as soon as we like, as I know, as soon as I learn more, I'm going to probably try to break it down like the process because I'm a process person. So from step to step to step. So hopefully we'll come back and be able to explain this even more once I get the steps through. Because right now I know I'm understanding the top level, but the like more of the reasoning behind it and digging more into the insurer side would be definitely interesting and ask these questions. And we would love to have a guest on. So if you're out there and have a lot of experience in this area, please reach out. We would love to bring you on and have this discussion and have you share as well.
Yeah, because there's always, there's always two sides to a story, right? You may hear from a payer that says, you know what, this is a costly treatment, and maybe we want to see if this less expensive treatment that you may not have to, maybe pay a higher copay on may help you, right? So, we want to hear from both sides. We are not here trying to say like this is wrong always. It may not be wrong always, but we just want people to be aware and to know their rights and to get educated and to learn about these things. Again, we're not experts. I'm not an expert. I don't claim to be an expert. I'm just, leading my organization, leading my friends, and empowering each other. And the more that I learn, the more that I will share with you. So that's
Well, we'll have to be back to add some more information because I'm interested too on the follow through. So if someone is going through this right now, they share their story, then what's next? How can we help them do something about it? And that is one thing because we get a lot of questions of people asking us different like how can I figure this out? And it's daunting to be in this position because there's so many things in all areas. So how can we best support people further from sharing their story? So what's next? So I would love to have a part 2 to this with ensuring people get the proper care. I mean, we're doing it through an assembly bill, so we're making changes through law and through bills and policies. But what else can the patient do right now to help make those changes and help them just get what they need?
Yes, and it may sound so intimidated when you're talking. It's intimidating when you're talking about like policy and all this stuff, but really these are just rules if you think about them that way that may help you. So think about rule number 1 helping you and being written for you. And I think if you think about it that way, it's probably the best easiest way that I think about it.
Well, let's make it easy for the patient because I understand how frustrating it is when you are managing a chronic illness and you're tired, you have brain fog, and now you're going to have to like fight for what you need or what your doctor prescribed. It's a task. And so, what tools can we offer our community to better streamline that process so it doesn't feel like a big mountain of a hurdle that you may have to give up on?
Yes, and you see this. It may not be, something that you're going through right now, but let's say you have to change insurance and your insurance right now is covering the best of everything for you, and you have to change your insurance, you lose your job or whatever it is, and then the new insurance has to have and makes you go through all these extra steps, for you to get the treatment that you were getting with your previous insurance. I mean, these are the things that we need to kind of learn about and how it impacts us. So yeah, we definitely have to do a part 2, Melissa. I think this is a conversation that we need to continue to have. This is about, our care, and this is about how these policies make a difference in our lives.
Exactly. So we'll be back soon, and then we'll be back with our regular programming of our impact tour with new interviews. So next week we have Crowning Lupus. I'm also excited to bring in Tony from Change MS. It is MS awareness, so we wanted to get some MS aware warriors in for March, and he's amazing. I got to connect with him through Dr. Terry Walls, so I'm excited that he's going to be a guest coming up. And then we'll just keep connecting with all of you. So please, thank you for everyone who tuned in today, like and share this video with your other friends and let them know about the work that we're doing.
Yes, because sharing is caring.
Thank you, everyone. We'll see you next week.
Bye.